Buying two airplane seats don't fix my problem. Airplanes are too small for big people. It's 2024. Bodies are changing, so planes should too. I won't lose my to fit on a plane. So give me another solution or just make the seats bigger.
Should airlines make their seats bigger for her butt? Or maybe should she buy first class tickets or 2 seats? What do you think? That weird beard-looking muscle is called the mentalis muscle, and this is a muscle that attaches from the bone of your chin to the skin of your chin. And when you make basically that face like this, you are contracting that muscle. Now this is called the golf ball chin when that muscle is contracted. And some people, believe it or not, will actually have Botox injected into that muscle. 2 little injections right here, a few units on each side is all you need, and it smooths that golf ball chin right out. Stinky pregnancy toots are real. And this is due to progesterone. Progesterone is a hormone that increases during pregnancy. And when progesterone increases, the GI tract slows down. And so the food that a pregnant woman eats takes longer to get through that GI tract. The longer the food is inside the colon, the more it ferments, the more that creates gas, and that gas can get stinkier and stinkier. So husbands and partners, be understanding that the pregnant woman sleeping next to you may be rooting and tooting all night, but it's not necessarily her fault. It's the progesterone and the pregnancy that's doing it.
Burn it.
What?
Did I say stand there and look stupid? No, I said burn it.
There is a belief that if you get a sunburn or even a suntan, that this can improve your acne. And the truth is that getting a sunburn or a tan can actually cause your skin to dry out a bit. And this can temporarily improve the appearance of your acne. However, the problem is that drying your skin like this artificially can lead to a feedback loop where your skin cells notice that there's not much oil, that it's dry, and will create more oil as a reaction to it. So your skin can end up greasier and actually with more acne long term than if you did not get those suntans. So if you've got issues with acne, then I don't recommend using the sun to try to improve it necessarily. Instead, consider retinoids, consider eating a healthy, non-inflammatory diet, take a daily probiotic, and talk with your dermatologist about what you can do to improve it.
You know the eyebrow blindness trend that's going on right now? What do you think we are blind to currently that in 5 to 10 years we're going to look back and be like, what were we doing? Why did no one stop me from doing that?
Oh, no question. It is the artificially plumped up lips. I mean, I'm a plastic surgeon. I see it in my office all the time. Everybody wants their lips plumped up. They want them to look like they've been plumped up. I can't tell you how many patients I turn down every year who want bigger and bigger lips. The key to a good lip enhancement is to keep the natural lip proportions the same. The lower lip should be about 50% thicker than the upper lip. And when those proportions are reversed, and sometimes patients ask for this, they want the upper lip bigger than the lower lip, that's when you start looking like a duck. Beautiful woman. Ah. This is a phenol peel. But her skin does look a lot better afterwards. Wow. I made a video all about phenol peels right up here. If you want to take a peek at it after this video is done, you got to take a look because this is the crazy progression that occurs after you get a phenol peel. This is a dangerous peel. You literally have to peel a third of the face at a time. It can work wonders for acne scarring, for, as you can see, solar damage like that. But man, you got to go through a lot to go through this peel. It is not fun. You got to take a peek at that video after this one is done because it will blow your mind.
I have had 2 million people asking me so many questions about these £5 nose job kits that I got from Amazon, and I'm gonna show you how I put them in and you begin by pushing the bit without the plastic inside of your nose, then push this bit with the extra plastic. You just kind of push it up because it's already kind of jammed in there. You can already see, and I could push it up, but you can already see my nostrils. Like my nose shape just changed. I look like I had like a 7,000 pound nose job.
So would you jam plastic and rubber splints into your nose to make it look more contoured? I mean, that's what she's doing. I mean, it's less painful, I guess, and definitely less expensive than a nose job. Obviously, something like this is not a permanent solution to wanting your nose reshaped. And the risks involved, albeit not huge, I mean, I guess you could aspirate it. If you leave that in your nose and you fall asleep and it falls out of place, you breathe it into your lungs and you can aspirate it. It could get stuck in your lungs and that could be a major, major problem. Otherwise, if you do leave it in long term, you could potentially get excoriations. You could get irritation of the inner mucosal lining of your nose because it's not used to having this type of splint on the inside. So I don't know, I think for like a temporary use one time, if you want to go on a date and look a little different, or a class reunion, or take pictures, I guess. But this is not something that I recommend that you do long term. Ooh, that happens to me all the time. Does that happen to you all the time? It's so annoying, isn't it? This is myokemia, or the eyelid twitching, that can get so annoying and it seems to come out of nowhere. There are definitely some causes with it. The main cause of it is lack of sleep and being really tired. And so getting better amounts of sleep, reducing the amount of caffeine that you intake, that you eat or drink, that can also help decrease the risk of this. And if all else fails, injections of Botox can definitely stop it.
E terminamos a cirurgia dessa menina que acordou junto com a gente. Ó, a gente não faz com anestesia geral, fazemos com sedação. Então a paciente já termina a cirurgia, já acorda. Aqui dá para ver a rede e olhem como tá bonito o contorno dela. Ficou lindo o contorno.
This is a hemostatic net, and this is suturing that basically is taken from the skin surface down to the underlying fascia or muscle area. And the idea is that this patient underwent a facelift where the skin was lifted off the face and pulled up and the skin removed and stitched into place. And by putting this hemostatic net of sutures into the face, it can lower the risk of postoperative bleeding. Now, these sutures are removed 2 to 3 days later to prevent scarring from that net of sutures. But I tell you, I performed a facelift this morning and my hematoma rate, my rate of bleeding postoperatively, is probably less than 1 or 2%. And one reason why is because of the techniques that I use to make sure that there's not bleeding at the end of the operation, and because I use tranexamic acid. And this is a substance, it's very inexpensive, that I mix with my local anesthetic that can lower the risk of postoperative bleeding. So if you're gonna have a facelift, don't worry, you don't necessarily have to have a hemostatic net to prevent you from bleeding afterwards. Does this happen to you? Well, this is called a hypnic jerk, and this is a motion that your body makes, a twitching that it makes sometimes when you're falling asleep. And the belief is that this happens because your body thinks that you're actually falling physically, and so you jerk. Now, this happens to me, honestly, all the time, and there are certain things that you can do to help prevent it. One of the things is to avoid exercising within a couple hours of going to sleep. That may help lower the risk that you're going to get a hypnic jerk.
Hey everyone, it's Injector Chris here at Lushful Aesthetics. I'm here with my lovely patient, and today we're going to be doing Holtox. So you're probably wondering what Holtox is. Well, it's Botox for your hole.
No, I'm not wondering what Holtox is. Next. Fat dissolving injections do actually work. The one that's FDA approved here in the United States is called Kybella, and this is made of deoxycholic acid. It's a naturally occurring substance in our GI tract that basically dissolves away fat. So it is FDA approved for injection into the double chin area to melt that fat. And it usually takes about 3 to 4 treatments for optimal results. Now this is just honestly kind of crazy because the fat that you dissolve with these injections is a tiny amount each time. And to have an area of the body that's that big, somebody's tummy, whether it's a larger person or a smaller person, usually is way too big to consider fat melting injections. It makes a lot more sense to either do actual liposuction or cool sculpting or sculpture where you could treat much bigger areas in a much less expensive way overall. This treatment, in my opinion, is honestly a waste of the patient's time and of her money, and she's probably going to be very, very let down after she sees the results. When a patient poops in the operating room, that's called a code brown. And this does happen rarely, not often, but rarely it can happen in the OR. And I really hand it to the whole surgical team. Usually it's the nurses and the techs that help to clean the patient up. I would love to tell you that the surgeon and the anesthesiologist helps with this type of thing, but honestly, usually they don't. They feel they're too uppity to do that. But I think it is important for us surgeons, us doctors, to realize that yes, we're part of the whole healthcare team, and when this type of thing happens, we've gotta help out too. So I always end off my TikTok reaction videos with a TikTok of my own. Let's take a peek at it.
Well, well, well. Look who's come crawling back. Had enough of her spiking your glucose, have ya? I should have known what you were up to from the start.
So I showed you a phenol peel in the last video and you haven't seen nothing yet. You gotta take a peek at this video right up here where I show a compilation of different patients getting phenol peels. It will absolutely shock you, it will amaze you, and the results are pretty impressive. Take a peek and remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.